Now to question in the name of Deputy Catherine Connolly.
Minister, has your attention been drawn to the crisis in Galway in relation to home care packages and the fact that they overspent the budget, and there's a severe crisis now where there's delayed discharges and delayed admissions in the hospital? Could you specifically address whether your attention has been brought to that, and if so, what you're going to do about it?
And can I thank the Deputy for raising this issue, just so it has been brought to my attention. The original allocation for home care packages and home help hours in 2016 for counties Galway and Mayo is in the region of 27.3 million. Home care services across the country are being stretched by demands for more people and for more hours in the evenings and at weekends, all of which cost more. Activity in the first quarter of 2016 was ahead of the same period last year, as efforts continued to alleviate pressure on the acute hospital system. Without additional funding, this could not have been sustained, and the allocations for the rest of the year had been reduced, or would have been reduced. Government has been able to respond to this situation by providing an extra 40 million for home care in 2016, of which Community Healthcare Organisation 2, which includes Galway and Mayo, received almost 5.5 million. According to the HSE delayed discharges report, as of the 27th of September this year, there were 30 delayed discharges in Galway University Hospital. Of these, 5 people had submitted applications for home care. On the 11th of October again this year, the HSE reported that this had reduced to 21 cases, with 2 applications being processed for home care. As part of the Winter Initiative, 1.8 million funding has been made available to provide 6 new home care packages each week from October to February at University Hospital Galway. This will provide for 114 new home care packages over the winter period. The hospital is also being provided with an average of 16 transitional care beds approvals per week throughout the course of the year. I'm pleased to say that overall funding for services for older people has increased to 765 million in 2017. It's an increase of 8.2. In a situation where demand continues to grow, as the Deputy has rightly pointed out, challenges remain in maintaining home care budgets. However, the increased resources provide additional flexibility to managers who are responsible for meeting these challenges in the different geographic areas within the resources available.
Sir, I didn't actually catch. Has the matter been drawn to your attention? Have you spoken with the hospital in Galway and with primary care in relation to this matter? That's a specific question. The second question is, as a result of the cutbacks in Galway City, there are patients in the hospital who can't be discharged and patients can't get in. I refer to one particular case where the patient had to stay in a B&B. I refer to the fact that meetings are taking place on a weekly basis, and where the role of the public health nurse has been extended to reduce the number of home care packages and the number of home help hours that patients are getting. On this phone, I have an urgent message in relation to a patient in the hospital, which I won't go into because we're in the Dáil chamber, but the point of it being the recommended package is 21 hours, and quite clearly 21 hours for this patient gives you an indication of the seriousness of the medical conditions, and the public health nurse's role is to reduce that, and they're now at 8 and they're negotiating in a situation where 21 hours is the recommended number.
Can I thank the Deputy again, and just to say that it is something that has been brought to my attention. I've not been at the hospital yet, but I would hope to be in Galway in the coming weeks, and it's something that I can address at that stage. I am aware that there has been exceptionally high numbers, particularly in Galway, of 224 on the 27th of September, 233 on the 10th of October were recorded. Similarly, there's been a high number of patients who have required acute admissions, about 40 emergency departments admissions each day, many of whom have been elderly and have had a variety of conditions, some of which you've outlined. I suppose just to reiterate, specifically for Galway Hospital, 1.8 million has been allocated within the Winter Initiative to provide the 6 new home care packages and also 114 home care packages over the winter period. If you were to look at the allocations from last year, we spent circa in and around 330 million, including 20 million in time-related savings, which accounted to 15,450 home care packages and 10.4 million home help hours. With the additional funding for this year, at the moment I can't tell how many hours and home help packages that will result in, but obviously when the service plan is drawn up, each area, including CHO, the CHO that we're discussing here will receive additional home care packages and home help as well.
Thank you. Minister, it's difficult to digest the figures you're given, and presumably I'll get a copy of all those figures. However, just to bring those figures down to a personal level, which I really don't like without bringing in stories into the Dáil chamber. But I have to do it to illustrate. You talk in these general figures and you talk about increases. At the moment in Galway there is a patient, and the patient is not unique, I won't say male or female, who cannot be discharged because the recommended number of hours cannot be given. I'm asking, how can you stand over that, given that the cost of keeping someone in hospital at a conservative estimate is 1,300, a nursing home 800 to 1,200, and the home care is the cheapest and the most effective and on a human level the best. Can you tell me, how can you stand over this today in the chamber where somebody can't be discharged and the public health nurse's role is really, she's been given, he or she, a terrible role to go out and reduce the number of hours? Are you telling me you're standing over that type of system?
Deputy, I suppose just to say this is a situation that I think we all find ourselves in, and that we have all found ourselves in throughout the year. The number of people seeking home help hours and care packages at the beginning of this year reached an unprecedented high, and without the 40 million in additional funding this year, we would see even more cuts than we are possibly seeing across the board now. What I have and what I will stand over is that we will be spending 68.4 million more on home care packages and home help next year than we currently are this year. And I don't like to put it in figures either. We're talking about somebody's mother or grandmother or brother or sister. But without that additional funding, we won't be able to provide that additional support. As it currently stands, I'm not able to give you the exact figures of how much will go to CHO2, which covers your hospital, but that will be decided in the coming weeks. And obviously the figures that I've discussed here, the increases this year and also next year, I can get to you in the answer as well.
We move now to questions.